Hello, this is Angelia, and you are listening to or watching the podcast Why You Do What You Do, the podcast that talks about human development and psychology to help you figure out maybe a little bit more about why you do what you do. And I was worried I might have to give this up, which I didn't want to do because I like teaching and I miss teaching, and this is what we're doing. I like to teach. So, but the Lord had put it on my heart to go deeper in my ministry, for folks who didn't seem to be kind of catching what I was serving. So, it looks like I'm going to have some time to do this, at least upon occasion. So, bear with me. We'll get her there, but there might be days missed. Now, last week I was sick. It was unbearably hot. We were blistering out here. I ended up with heat exhaustion, so, that's why I was down for a while. And then, I came under attack, I believe, from the other camp, with pestilence and things, and so, thankfully, that is eased. So, I am back, and hope to stay that way. And last time we were talking about, osteoporosis, which once you go through menopause, if you have not, kept I don't want to say athletic, but kept busy, so you're moving a little bit, keep your bones strong, and didn't get enough calcium and things, then you can have this problem. So, that's something you want to do and take good care of yourself. Well, smoking and all that's bad and contributes to it too. And then anyway, we're going to take back up on that. Genetic factors may dictate peak bone mass, but good lifestyle habits make a significant difference. So, like I say, all that smoking, drinking, drugging, stop all that if you want to keep your bones. Especially if started early in life. So those of you guys who started smoking or drinking or whatever in your teens, you're going to have a bigger problem with this. So you might want to go somewhere and get off of that stuff. However, bone loss, once started, can be slowed or even reversed with proper nutrition, weight-bearing exercise, which I get to do every day, and avoidance of smoking, which I never did anyway. But, your body is always renewing itself. It's always growing. So, once something's done, it tries to heal that. So, if you cooperate with the body and cut out the bad stuff and put in good stuff, you can actually heal things. So, do that. High-intensity strength training and resistance training have proven particularly effective. And they have like those bands, and of course they have the little dumbbells. I got a little one in my room, So, there are ways you can help yourself if this is something that's happening to you. Women over age 40 should get 1,000 to 1,500 milligrams of dietary calcium a day, along with recommended daily amounts of vitamin D, which I got in there in my medicine cabinet, which helps the body absorb calcium. Studies have found value in calcium and vitamin D supplements. So I've got my calcium supplements and my vitamin D in there, and I'm being a good girl and taking them. Breast cancer and mammography. If you haven't had a mammogram, go do it. It's embarrassing. It's a pain in the butt. But it's worth it to know, if you can catch it in a timely manner. 1 in 8 American women and 1 in 9 British women develop breast cancer at some point. So if you have British ancestry, you're more likely to develop breast cancer. As with other cancers, the chance of developing breast cancer increases with age. So the older you get, the more likely you are you can get it. Overweight women, those who drink alcohol, those who experience early menarche and late menopause, those with a family history of breast cancer, and those who bore children late and had fewer children have a greater risk of breast cancer, while those who are physically active, eat low-fat, high-fiber diets, are at less risk. So, again, taking care of yourself, proper exercise, proper diet will help nip that in the bud. Scientists have identified two genes, BRCA1 and BRCA2, that may be involved in a small percentage of breast cancers. Because women with the flawed genes have an estimated 85% chance of developing breast cancer someday, they may choose to have more frequent examinations and possibly even preventive mastectomies. And we all know Angelina Jolie, had that's done, and evidently that's something she had in the history of the family, and no one can blame her for that, because that's a horrible disease and it kills, and nobody wants to go through that if they don't have to. Advances in diagnosis and treatment have dramatically improved prospects for breast cancer patients. That's why I say getting those mammograms. I didn't want to go get mine, but I went and got mine. I'm due for another one, but we'll see. I'll get it as soon as they say, "Hey, you need to go do that." I'll be like, "Okay," because it's not fun. But if they catch something that's a pea size versus something that has spread throughout your whole body, that's a good thing. They can do more with a pea size thing than they can with something that's gone through your whole body already. More than 95% of women with breast cancer can survive at least 5 years if the cancer is caught before it spreads, and 50% can expect to survive at least 15 years. Although benefits of mammography, diagnostic X-ray examination of the breasts, appear to be strongest for women over 50, a U.S. Preventive Services Task Force recommends screening every 1 or 2 years for all women beginning at age 40, especially those with a family history of breast cancer before menopause. So, if that's back in your DNA, you're going to want to keep an eye on that. Hysterectomy. Nearly 1 in 3 U.S. women has a hysterectomy, or surgical removal of the uterus, by age 60. And that used to be a lot more common, but finally, women doctors have come up and said to the men doctors, "Why are we doing this? There's no reason to do this, and just because she's got a problem, you can treat this with a smaller surgery. You can treat this with meds. Why are we ripping people's uteruses out for no reason?" The surgery is generally done to remove uterine fibroids, benign tumors, or because of abnormal uterine bleeding and endometriosis, which is a very painful condition, I have heard. So, a lot of times that's the case. Now, my mother-in-law, they did hers, after she had her last child. She just told the doctor, she's, "Take it all out. I want it all out. I don't want to deal with it." And so they did. If you can imagine that. Hysterectomy rates are second only to rates for cesarean section in surgery performed on U.S. women. And a lot of female doctors also say that is done way more often than need be. Australia, New Zealand, and most European countries it's done 3 times higher than Australia, New Zealand, and most European countries. About 2/3 of those operations in the United States are abdominal hysterectomies. Nearly 1/4 are vaginal hysterectomies, which usually involve shorter hospital stays, lower costs, fewer complications, and better outcomes. A third type, laparoscopic hysterectomy, which requires only a few small incisions in the abdomen, is growing in popularity. Now, I had laparoscopic surgery when they took my gallbladder out. Vaginal hysterectomy is much more popular in other countries, according to accounting for 40 to 50% of the procedures in France and Australia. So they're ahead of the curve, which usually are, us Puritan Americans. Many experts believe that hysterectomy is overused. In a study of 9 managed care organizations in Southern California, 76% of the recommended hysterectomies did not meet established criteria of the American College of Obstetricians and Gynecologists for this type of surgery, usually because of failure to first rule out other conditions or try alternative medical or surgical treatments, like I said earlier. Painful or bleeding fibroids, for example, may be treated by myomectomy, cutting away only the fibroids and not the entire uterus. Mycolysis, electrical current, or embolization, cutting off their blood supply. So, there are other surgeries that can be more effective than actually performing a hysterectomy. And then you don't have to worry about not having ovaries and, uterus and things of this nature. Hormone replacement therapy. Since the most troublesome physical effects of menopause are linked to reduced levels of estrogen, hormone replacement therapy, or HRT, in the form of artificial estrogen is often prescribed. As many as 38% of postmenopausal American women have used HRT. Because estrogen taken alone increases the risk of uterine cancer, women whose uterus has been surgically removed are usually given estrogen in combination with progestin, a form of the female hormone progesterone. Now, however, medical evidence has begun to challenge some of HRT's presumed benefits and bear out its suspected risks, because there are suspected risks when you take estrogen after you have gone through menopause. Besides relieving hot flashes, hot night sweats, and vaginal dryness, HRT is often used to prevent or stop bone loss after menopause. HRT is thought to be most effective, even in low doses, when started at menopause and continued for at least 5 years. However, an analysis of 22 studies by British researchers found no benefits in starting treatment after age 60 and also questioned the benefits for younger women. Taking HRT for only 5 to 10 years will not prevent future osteoporosis. Bone loss resumes whenever HRT is stopped. So you're messing your body up by doing this, and they're probably going to take you off at some point, and then you're going to go back to losing bone. So they're not sure it's worth it. Early correlational studies suggested that estrogen, alone or combined with progestin, dramatically cut the risk of heart disease. Now, there could be some truth in that, because I had my heart episodes after I went through menopause, so. However, the validity of these findings was uncertain, because estrogen users tend to have better health habits than non-users, because they're taking better care of themselves, they're worried about their health. More recently, a large-scale randomized controlled study found that rather than protecting high-risk women, those who already have heart disease or related problems, hormone treatments either provide no benefit or actually increase the risk of heart attack, stroke, and gallbladder disease, just like, the pill. And I was on the pill. I had high estrogen anyway. I had problems with the pill. Like I said, I was on a mini pill and got sick. Well, after I had my first son, I had to have gallbladder surgery. My gallbladder was full of stones, and I had to have my gallbladder removed. So there might be some to, taking that birth control and problems with that. Other research found a greater risk of worsened coronary disease or death when HRT was combined with high doses of antioxidant vitamins. When a randomized controlled trial of estrogen plus progestin in healthy women was stopped after 5 years because the risks of breast cancer, heart attack, stroke, and blood clots exceeded any benefits. So, your doctor is not going to want you to avoid hot flashes if it's going to kill you. The American Heart Association now advises against HRT. Lifestyle changes such as losing weight and stopping smoking, and, if necessary, drugs to lower cholesterol and blood pressure may be wiser courses for many women. The effect of estrogen on breast cancer is still under study. One large-scale study found the risk of estrogen alone less than when it is combined with progestin. Heightened risk of breast cancer seems to be mainly among current or recent estrogen users, and the risk increases with the length of use. Long-term estrogen use is also associated with increased risk of ovarian cancer. So, I mean, that's not something you want to have either. Some epidemiological, my goodness, studies of HRT have found that women who use estrogen are less likely to develop Alzheimer's disease. And now my mother-in-law did take estrogen supplements after she went through menopause because she said her hot flashes were terrible. But she got Alzheimer's. So, you know. But only if they currently receive HRT and had done so for more than 10 years. There is no clinical trial evidence that estrogen improves symptoms or delays the progression of the disease. Estrogen also has been linked to improvements in cognitive functioning, particularly memory, in postmenopausal women. But this research has had conflicting results and has been criticized on methodological grounds, meaning they probably didn't do their due diligence like they should have. Furthermore, in a randomized 3-year study of 16,608 postmenopausal women, HRT had no significant positive effects on quality of life. So it wasn't worth the risk. With the safety and efficacy of long-term hormone treatment in question, many women no longer take hormones, and other treatments are being tested. And I don't take them. I don't feel the need, nor do I have any desire to. A new group of non-hormonal chemicals called selective estrogen receptor modulators, sounds like that thing from Bugs Bunny, his ER modulator, chiefly tamoxifen and raloxifene, sometimes called designer estrogens, seem to have favorable effects on bone density and possibly on cholesterol levels without increasing the risk of breast cancer, and greatly reduce the risk of breast cancer in women with a genetic predisposition. So these could be promising things. However, tamoxifen also increases the risk of uterine cancer, so that's definitely not good. Raloxifene, a drug normally used for treatment of osteoporosis, seems to reduce the risk of genetic breast cancer, but without negative side effects. So that might be a better looking drug right now. However, the long-term effects of these drugs have yet to be documented. So, not enough study has been done on them. Influence of emotional states, personality, and stress. Oh, yeah. There are a lot of people who have problems with their emotional states and their personality and their stress. So we're going to get into that. The ancient proverb of Solomon, a merry heart doeth good like medicine. Proverbs 17:22. We were throwing that little Bible into psychology, did you? Is being borne out by contemporary research. Negative emotions, such as anxious or depressed mood, is often associated with poor physical and mental health, and positive emotion with good health. So, if you're being sour, negative, stressed out, anxious all the time, that is really bad for your health. And if you're just taking things with a grain of salt, just keeping walking and trying to keep a positive attitude, you're going to be in better health. Because that stress is, putting that cortisol to work in your body, and it's going to raise your blood pressure. It's going to cause you to be nervous, stressed, anxious about everything. So that merry heart's a good idea. Negative moods seem to suppress immune functioning. So, the more negative you are, the worse your immune system is. Increasing susceptibility to illness, whereas positive moods seem to enhance it. So, the more negative you are, the more likely you are to get sick. The more positive you are, the less likely you are to get sick. So that's a good reason right there to try and be a little more positive. Furthermore, negative emotional states may lead people to think that they are more sick than they actually are, and may impair their judgment about what can be done to improve their condition. Because if they're depressed, oh, woe is me, it's all bad, and I'm gonna be like this forever, and blah blah blah. And they don't even try because they don't feel like anything can be done to help them. And there are people who won't go for psychotherapy because they feel like nothing can be done. This is just how I am, and that's BS. So if you feel like it's a problem in your life, go get some help. The health consequences of negative emotionality depend on how well individuals are able to manage and repair their moods. Yeah, you never probably thought about that you can repair your mood. It just, a lot of people, it's just something that waves through you, but you can stop, take a step back, think of a few positive things, and flip the script on your emotions. And this may be a function of disposition. And we inherit a disposition, but we also are influenced by the environment to have a certain disposition. But ultimately, you have the choice to step out of that negative mood and try to make it a little more positive. It should not be surprising, then, that personality is related to health. People rated as extroverted, agreeable, or conscientious are more likely to report excellent health than people high in personality dimension called neuroticism. Now that's the old word, but they sometimes still talk about that. Neuroticism. They're neurotic, nervous, anxious people. As an important aspect of the relationship between emotion, personality, and health is the way a person handles stress. Some people blow up to the moon. Some people just cave, drop to the floor. Some people are just like, oh no, I don't want to do this. I don't want to deal with this. Some people are like that. Stress, causes and effects. The more stressful the changes that take place in a person's life, the greater the likelihood of illness within the next year or two. So if really negative stuff is happening to you, the more likely it is you're going to get sick. That was the finding of a classic study in which 2 psychiatrists, on the basis of interviews with 5,000 hospital patients, ranked the stressfulness of life events that had preceded illness. And I was always sick as a kid, so that there might have been some reasons, but there is some physicality on that too. I have severe allergies and things, but somebody should have paid attention. About half of the people with between 150 and 300 life change units, or LCUs, these scientists are calling them, in a single year, and about 70% of those with 300 or more LCUs became ill, because stress makes you sick. When bad things happen to you, you feel bad, and that lowers your immune response, and you're going to get sick. Change, even positive change, can be stressful, and some people react to stress by getting sick. The most frequently reported physical symptoms of stress are headaches, stomach aches, muscle aches or muscle tension, and fatigue. And we have this a lot. I get headaches. The most common psychological symptoms are nervousness, anxiety, tenseness, anger, irritability, and depression. These are different kinds of stressors, stress-producing experiences. Hassles of a day-to-day living are associated with minor physical ills such as colds and may have a stronger effect on mental health than major life events or transitions, or chronic or long-lasting problems. Excuse me. So, the more stressful your life is, the more it's going to impact your health and cause more and more things to be wrong with you. The connection between stress and illness has long been observed, but only recently have we begun to understand more about how stress produces illness and why some people handle stress better than others. Intense or prolonged stress seems to weaken the immune system and increase susceptibility to illness. So if you're in a prolonged stressful situation, that is really bad for your health, and it's gonna cause you to have probably some health issues. Research has found suppressed immune function in breast cancer patients. So, it can even leave you susceptible to cancer. So that's a very bad thing. So now they've done a rating of life events in order of diminishing stressfulness. So the top one, and they're giving them a value, a percentage value, I'm assuming. Death of a spouse, 100. Divorce, 73. Marital separation, 65. Jail term, 63. Death of close family member, 63. Personal injury or illness, 53. Marriage, 50. Because yes, it is stressful to get married. It's a good thing, but it's also stressful because now this other person's involved in everything in your life, and you got to move their stuff in, and it can be stressful. Being fired at work, 47. Marital reconciliation, 45. Retirement, 45. You wouldn't think that, but some people don't handle retirement very well, and it stresses them out. Change in health of family, 44. Pregnancy, 40. Sex difficulties, 39. Gain of new family member, 39. Change in financial state, 38. Death of close friend, 37. Change of work, 36. Change in number of arguments with the spouse, 35. Foreclosure of mortgage, 30. Change of responsibility at work, 29. Son or daughter leaving home, 29. Trouble with in-laws, 29. Outstanding personal achievement, 28. Now, why is that stressful? Because a lot of people have a problem with success and don't feel like they deserve it. And it's also stressful to get up and accept awards and be in front of people and maybe have to speak, so there's a little stress involved sometimes. Wife beginning or stopping work, 26. Beginning or ending school, 26. Revision of habits, 24. Trouble with the boss, 23. Change in work hours, 20. Change in residence, 20. Change in schools, 20. Change in recreation, 19. Change in social activity, 18. Change in sleeping habits, 16. Change in number of family get-togethers, 15. Change in eating habits, 15. Vacation, 13. Minor violations of law, 11. Now you might say vacation, but yeah, getting ready to go on vacation, you're going to make sure everything's right. If you're making reservations and you have flights and things, you're going to make sure all that's right. You got to make sure you have enough laundry, clean, to take. You have to decide, am I taking another bag? Am I going to buy stuff when I get there? So there is some stress involved in going on vacation, but usually it's happier stressed, It's usually happier stressed. Abused women, hurricane survivors, and men with a history of post-traumatic stress disorder also show a higher risk of illness. Stress also may harm health indirectly through other lifestyle factors. People under stress may sleep less, smoke and drink more, eat poorly, and pay too little attention to their health, which, we all know one of the first things people talk about is comfort food when you're stressed out. Conversely, regular exercise, good nutrition, at least 7 hours of sleep a night, and frequent socializing are associated with lower stress. Because, when you're happy and you're doing okay, you're not stressed out. Some adults drink under economic, marital, or job stress. But while low doses of alcohol may reduce stress response and improve performance, higher doses may actually induce stress by stimulating release of adrenaline and other hormones. So, like the doctor says, 1 drink a day is good for you. More than that is bad for you. So, if anyone has ever drank too much, that's not good for you. You should take your body's signals that that's not good for you. And that's where I'm going to leave you for today. I hope this helped you figure out maybe a little bit more about why you do what you do. Thanks for watching. Please like and share this educational program so we can spread it around the world. If you want to help me, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. That's all for now. Until next time.